Hi everyone, this is Dr. Buddy Donaldson, and today we're going to talk about why early treatment is needed, and it's also called what is age-appropriate treatment. So, a lot of times in our classes, before we understood what was not normal, we would look at, okay, what is normal and what are we trying to do? Well, let's take a look at what we're trying to do right here. This is a great bite. Now, we can take a look right here. There's enough room for all of the permanent teeth, so the permanent teeth are in straight. The other thing that we will notice is that when the teeth fit together, an upper tooth fits between two lower teeth, and you can see that all the way around. An upper tooth fits between two lower teeth. The midlines match up as well, where the middle of the upper two front teeth match up with the middle of the lower front teeth. So this is what we are trying to accomplish when we are doing some early treatment, so we can create a situation where these teeth will fit together. Now, let's take a look at this. This was an adult that came in to see me, and let's take a look at these arches. You can see where there's some teeth that have been lost, and there's some crowding here. Over here we'll take a look, and we'll see that their arches are very narrow, and early treatment tries to address narrow arches. So if we look at this person, you can see where there's a crossbite. A crossbite means that the upper tooth fits between the lower teeth. So the upper arch is very narrow here, and you can see that upper arch is very narrow, especially when you compare it to an upper arch that has the right width to it. Now, another reason to use early treatment would be if the jaws don't match up. Well, let's take a look here to where, and this is called a class 3 bite, to where the lower arch is in front of the upper arch. That's called a class 3. Okay, now let's look at this one. This is called a class 2 bite, to where the upper teeth stick out too much, and that instead of everything fitting together, all of this is a tooth forward. So these two lines should match up, but instead the upper arch is too strong, and you can see where the upper teeth stick out too much. Early treatment would want to address that, so you can try to normalize the relationships to allow the bottom jaw to come forward, the upper arch to go back, so you can get things to fit together better for this particular patient. Let's look at a couple other things here. Take a look at this. In this particular bite, again, the front teeth stick out too much, so that's one of the reasons we want to try to do early treatment. And the arch is narrow. You can compare that narrow arch when we showed some previous pictures of regular arches, and again, when we compare, you look at the upper arch here, and you look at the upper arch there, and you can see where that upper arch is just way too narrow and needs some treatment to try to address that narrow upper arch. An open bite. This particular patient right here has both an open bite, where the top teeth don't overlap the bottom teeth, and a cross bite, where the top teeth fit on the inside of the bottom teeth, and those are areas where early treatment would be needed. Let's take a look at another one. Let's take a look at this particular patient. Let's look here. Now if you look right here, and we'll focus, the bottom arch is crowded, but let's look at the top. Now if you look at the top, there comes an eye tooth right there. There's the other eye tooth, and you can see where there's not enough room for the eye teeth to come in. That is another reason why early treatment would be needed, to make room for all the permanent teeth, and to make sure that the upper eye teeth don't come in and look what some people would say look like fangs. So, I think that those are some of the reasons why we would want to do early treatment. So, when there's not enough room for all the permanent teeth, when the arches are narrow, when the upper arch sticks out too much, or when the bottom jaw sticks out too forward compared to the upper arch. So, that's why we do early treatment here, and if you have any questions, please give us a call at Donaldson 3D Orthodontics.